Hello everyone, a very good evening to all of you. I welcome you all for today's session. I am Dr. Priyanka Sachdev here, and today I am here to take a very important and you must say a difficult topic of General Pharmacology, Pharmacokinetics, that is apparent volume of distribution. So let me come on the topic directly without wasting any further time. So today I am going to teach you this topic, apparent volume of distribution, the numericals based on that, what is the concept behind that. Now, I must say it is one of the difficult topic of general pharmacology or pharmacokinetics in which students find very trouble. So, I will simplify this topic for you. I will help you to understand it with simplicity. So, give me a minute. So, for understanding what is apparent volume of distribution, you should have a concept what is distribution. So, let me start with the beginning. We know that pharmacology is the science of the drugs. We know it is the science of the drug. In pharmacology, we already know there are two branches, pharmacokinetics and pharmacodynamics. PK and PD, pharmacokinetics and pharmacodynamics. We know that pharmacodynamics is what the drug doing to the body. What the drug doing to the body is known as pharmacodynamics, D for drugs. Right? It includes the mechanism of action of the drugs. And what is pharmacokinetics? What the body is doing to the drug. So what the body doing to the drug? The body is doing four things to the drug. We have already seen the details in the last session. So we already see this diagram. This is our master diagram in which we are going to understand the entire pharmacokinetics, right? So as soon as we are considering the oral route. So this is a drug given by the oral route to a patient. This is the patient. So as soon as you are giving the drug to any patient via oral route, the drug is going to the mouth, to the esophagus, to the stomach, and then to the intestine. Now, acidic drugs are absorbed from acidic medium, that is stomach. The basic drugs are absorbed from basic medium, that is intestine. Ultimately, all the drug reaches the blood, right? This step is known as absorption. We have already finished absorption in the last sessions. I guess everyone knows it. The factors affecting absorption, what is bioavailability, I guess you know it. You have the concept. So, absorption is the administration, is the movement of the drug from the site of administration. This is your site of administration till circulation. The drug finally reached in the circulation, right? Now, after coming in the circulation, the next step will be the distribution. That is my topic today, right? We have already finished chapter 1. The chapter 1 was absorption. We have already completed it. Now, today's chapter is distribution, in which the most important topic is volume of distribution. That I am going to teach you. Now, the drug is already in circulation. The drug is already in the blood. Now, listen everyone very carefully here. So, as soon as the drug is coming in the blood, in the circulation, I mean. So there is what happens now actually. This drug is known as free drug. Whatever the drug coming from the stomach and intestine after absorbing from the GIT, it is coming to the blood. That is known as free drug. A portion of free drug. I'm not committing what portion. It can be 10%. It can be 90%. A portion of free drug get bound with the plasma protein. I will tell you the name of the protein. Can you see this blue color is the protein? Now this drug which is bound to the protein is known as bound drug. So in the blood there are two type of drug. The free drug which is free, which is not bound with anything. It is free drug. It is free drug. And the amount of the drug, a small proportion of the drug which get bound with the protein. So the drug, can you see the red color is the drug and blue color is the protein molecule. So the drug which is not free, it is bound to the protein, it is known as bound form. So drug occurs in two forms, the free form and the bound form. The free form and bound form. Two types of drugs are present in the blood. Have you got it? So these two type of drugs are present in the blood. Now out of the two, how much will be free? Whether free is 10% and bound is 90%, or whether bound is 10% and free is 90%. That depends from drug to drug and various factors that I will teach you separately in plasma protein binding. Okay? Now listen my words very carefully. Have you got this concept till now? Now, the free drug will enter in various tissues inside the body from the blood, and this is known as distribution. This is known as distribution. What is distribution? What is distribution? Distribution is the entry of the drug from the circulation to the various tissue. That is known as distribution. Which drug will do so? Is it free or bound? Kaun sa drug enter karega? The free drug will enter in various tissue. Bound drug will not enter. Bound drug will remain in the blood only. You got my point? So, till now the tissue is having zero concentration. It is having zero concentration of the drug. So, drug will move according to the plasma concentration gradient. Here the concentration of the drug is high in the blood. and here in the tissue it is 0, you can say, or it is low. It is low, or you can say technically it is 0. So drug will move from the blood to the tissue till a equilibrium is set between the blood and between the tissue. So it is the free drug which will leave the blood and go on entering in the tissue till what point? Till the concentration of the free drug here in the blood is same as the concentration of the drug in the tissue. When the concentration of the drug in the blood and in the tissue becomes same, it is known as equilibrium established. Now this movement no more will happen. You got my point? This movement. But I am saying only free drug is moving. The bound drug is not moving. ये सब समझना अच्छे से. अगर तुम्हारे बेसिक कॉन्सेप्ट स्ट्रॉन्ग है ना, तो आगे पूरा फार्माकोलॉजी इज अ फन, राइट? फार्माकोलॉजी इज लाइक मैथमेटिक्स. आई ऑलवेज गिव दिस एग्जांपल टू माय स्टूडेंट्स. इन मैथमेटिक्स you don't learn the answers of every questions. So whenever you have given the addition, subtraction, multiplication, anything, you know the basic rules. So how to add, how to subtract, how to multiply, how to do the divisions, what are the theorems, how to apply the formulas, right? Once you understood that, now solving the numericals will be fun. So same applied here in pharmacology. You should understand the general pharmacology with with your concept building. If you have thorough concepts in general pharmacology, now understanding systemic pharmacology will be fun for you, like mathematics solving, right? Solving questions in mathematics. So okay, let me continue. Let me come on the topic again. So it is the free drug which is moving to the tissue till equilibrium established. So when the free drug will move to the tissue, the concentration of free drug go on falling in the blood. You will ask me, ma'am, what is the use of this bound proportion? The drug which is bound to the protein, uska kya use hai? What is the use? So whenever the concentration of the free drug will fall, bound will give the backup. The bound will release the drug and convert into free drug till the equilibrium established between the two. You got my point? So whenever I am saying ki it is only free drug which enters the tissue, bound drug do not enter the tissue. But when free drugs enters to the tissue, the concentration of the free drug falls in the blood and bound drug get converted to free drug. The bound drug goes on converting into free drug. So it is the parallel decline of both. It is the parallel decline. मैं हिंदी में कहती हूँ, जो फ्री ड्रग है वो टिश्यू में एंटर करेगा, बाउंड नहीं करेगा. लेकिन कब तक करेगा? जब तक ब्लड और टिश्यू के बीच में इक्विलिब्रियम ना आ जाए, कंसंट्रेशन सेम ना हो जाए. ऐसा करते करते फ्री का कंसंट्रेशन फॉल होने लगेगा. जब फ्री का कंसंट्रेशन फॉल होगा तो बाउंड बैकअप देगा एंड बाउंड विल गिव द बैकअप एंड बाउंड विल कन्वर्ट इनटू फ्री, जब तक वापस इक्विलिब्रियम ना आ जाए इन दोनों में. तो इक्विलिब्रियम इन दोनों में भी होता है, इक्विलिब्रियम इन दोनों में भी होता है. यू गॉट माय पॉइंट? यू गॉट माय पॉइंट? सो दैट इज द फ्री ड्रग, right? Now this is distribution. Now drug has already shown its mechanism of action here. The free drug, it has already shown its mechanism of action on the tissue in the site of the entry. Listen, now drug want to get excreted, so drug will go to the kidney. So again only free drug can be excreted out of the body. Bound drug cannot directly go to the kidney and get excreted. So it is the free drug, it will go to the kidney and try to excrete out of the body. But since the drugs are non-polar, we have to convert non-polar drug to polar drug first before excretion. Because in urine, only such drug will be excreted which is water soluble. But most of the drugs are not water soluble. They are not polar. They are non-polar. So first you have to convert a non-soluble drug to a soluble drug, water soluble drug. That is a non-polar drug to polar drug. That happens in liver. Again, the free drug goes to the liver and does the metabolism. This is known as metabolism. So it is the free drug which goes to the site of action and show action. It is the free drug which goes to the liver and shows metabolism, and it is the free drug which goes to the kidney and get excreted of the body. You can't believe कि बहुत कम बच्चों को ये सब concepts पता होते हैं. बहुत कम students, a fraction of students knows these concepts thoroughly. Most of the students just go through the books and they don't understand what the author really wants to give you the concept behind that, right? So it is the free drug. You will ask me, ma'am, then what is the utility of bound drug? The bound drug is only the backup. When the free drug is entering here, here and here, the concentration of the free drug goes on falling. At that time, the bound will give backup to the free and bound will convert into free. So gradually bound convert होते होते पूरा free में हो जाएगा. You got my point? You got my point? So this is how the things takes place. So this is distribution. So let me start distribution. Chapter number 2 of Pharmacokinetics. Distribution. ये तो overview था. अब देखो exam में लिखना कैसे. If you are a second prof student, see how to write it. So drug distribution. What is the definition? It is the delivery of the drug to the tissue from the circulation to the tissue. That is known as drug distribution. So in the circulation, drug is already there. Now from the circulation, it is going to the tissue, the various tissue. It is going to the site of action to show its mechanism of action. It is showing to the liver to get converted from non-polar to polar and get metabolized. It is going to the kidney for excretion, right? So it is entering in various tissue, and this is known as distribution. Distribution is delivery of drug to tissues. Again, I am saying delivery of drug to tissues. That is movement of drug from blood to tissue. This is known as distribution, right? What was absorption? Absorption is movement of drug from site of administration to circulation. Site of administration से लेके circulation तक आना is absorption, और circulation से आके tissue में जाना is distribution. You got my point? So that is known as distribution. So that is a definition everyone can understand. So same diagram from KDT, you can see some book, and it is shown the same thing. What is distribution? It is the entry of the drug from the blood to various tissues. So that is, now you have understood this thing very clearly, but in the university exam of second prof, you don't have to write the complete story like a paragraph. You have to write in the form of the flowchart. Flowchart के दो फायदे हैं. There are two advantages. Number one, तुम्हारा time save होगा, right? Whenever you are writing the paragraphs, you require more time to write your answer. But whenever you are writing a flowchart, अब ये flowchart तुम अपनी exam copy में draw करोगे. It requires one page. So you will write one line, leave one line, write one line, leave one line, and you will mark arrows. So complete one page is required to draw this flowchart. अब इसको पैराग्राफ में लिखोगे तो it will get compacted in 3-4 lines only. Number one, तुम्हारा time save हुआ. Number two, copy filling ज़्यादा हुआ. You know, in long answers you have to fill the pages, right? For long answers you are given 5 pages or 7 pages to write down in a long answer. In some university it is 20 mark question, 10 mark question. So you have to write pages. So यहाँ पे proper आपका filling होगा. दूसरा, आपकी copy का look अच्छा है, right? It is not messy. It is step by step. 1, 2, 3, 4, 5. Number 4, you are starting from the beginning till end, and you are giving the entire concept to the examiner. So if I am the examiner, I am checking your copy and you have drawn this flow chart, तो देखते से मुझे समझ में आ जाएगा कि ये बच्चे ने पढ़ाई की है, इसको पता है, तो मैं बहुत ज्यादा थॉरो ना जाके I will give you the marks. ठीक है? और आगे पीछे तुमने ज्यादा नहीं भी लिखा है, फ्लो चार्ट प्रॉपर बनाया है, डायग्राम प्रॉपर बनाया है, I will give you the marks. Right? So it is the mentality. You have to understand the mentality, the psychology of the examiner. ठीक है? एग्जामिनर को कॉपी चेक करते समय क्या चाहिए. By the way, I will take a separate session जिसमें यूनिवर्सिटी एग्जाम में डिस्टिंक्शन और गोल्ड कैसे लाना है. I will tell you that in university exam, in second prof university exam per se. So how to write answers in university exam copy. How to write. What is the technique? Now 2 students are there, they are studying same, or rather one is studying less, one is studying more. Still the one who is studying less getting more marks always in university exam. Why? ऐसा क्यों है? The way the presentation, the second student is doing the presentation in the copy, that is more important. ठीक है? चलो, anyways, तो आगे बढ़ते हैं. आपको ऐसा flow chart लिखना है, right? So you tell me as soon as the drug is entering into the blood, you can see this is the drug entering in the blood. इसके आगे की कहानी शुरू करो. So what is happening after that? This drug is free drug. Now a portion of it will bind with the protein, and it is known as bound form. A proportion of it, this is the free drug, and it is bind with the bound with the protein. It is known as bound form. Now it is the free drug which will go to various tissues, not the bound. It is the free drug which will go to the tissue. कब तक जाएगा? Till equilibrium is established. Till equilibrium is established between the blood and the tissue. The free drug. ऐसा करते करते the free drug will decline. The concentration of free drug will decline in the blood. So the bound will give the backup. The bound will give the backup, and there is parallel decline of the bound also. The parallel decline of the bound also, because bound is getting converted to the free. So the bound form will dissociate and convert into free form to establish the equilibrium again. So it is the free drug which is moving everywhere, not the bound. And bound is acting as a backup. So you have to write like this in the form of the flow chart and draw this diagram and explain what I have explained you. So 2 forms are there, free and bound. अब एक बात बताओ. You tell me one thing. What is the name of this protein? What is the name of this protein to which this drug is binding? Does anyone know the name of this protein? You will say, ma'am, it depends whether the drug is acidic or basic. So 2 different proteins are required. If the drug is acidic, you say, ma'am, this drug is acidic. So I must say acidic drugs bind with albumin. The name of the protein is albumin. Right, this is for acidic drugs. You will say, no ma'am, the drug is basic in nature. You know there are 2 types of drugs. Now in our last session we have already completed. So this is a basic drug. You will say, ma'am, it is a basic drug. So the name of the protein here, it will become alpha-1 glycoprotein. Alpha-1 glycoprotein is the name of the protein. So acidic drugs bind with albumin. Basic drugs bind with alpha-1 glycoprotein. How you will learn it? How you will learn it? You have to learn it, right? So acidic drugs bind with albumin. It is a protein. and basic drug bind with alpha 1 acid glycoprotein. It is a protein, right? So that is the thing. That is the thing here. Now you have to learn certain examples of important drugs. Now there are million of drugs in the world. We cannot learn every drug which is acidic, which is basic. But at least these are the important drugs which are acidic in nature. That's why they all bind with albumin. For example, barbiturates and benzodiazepines, these are used as sedatives and anti-anxiety drugs. You may be knowing, right? These are the sedatives. NSAIDs, you may be knowing they are painkillers, right? Commonly known as painkillers. Valproic acid, it is used as an anti-epileptic drug. Phenytoin, again anti-epileptic drug. Penicillin, sulfonamide, tetracycline, tolbutamide, these all are your antibiotics, the various types of antibiotics. And warfarin is your anticoagulant drug. So you may be knowing all these names. These all are acidic drugs which are commonly used, right? And among the basic drugs, if you say, all the basic drugs get bind with alpha 1 acid glycoprotein. So the examples are in front of you, the important examples, the common examples. Beta blocker, you know what is beta blockers, right? Bupivacaine, right? It is the anesthetic drug. Lidocaine, right? So these all you can learn few examples of both sides. So acidic drugs bind with albumin and basic drugs bind with alpha 1 acid glycoprotein. Never forget this concept or learn the examples. The question can come based on the example. Examiner may not tell you whether the drug is acidic or basic. The question can be as simple as that phenytoin bind with albumin ki alpha 1 glycoprotein. So you must know that phenytoin is an acidic drug. So it will bind with albumin, not with alpha 1 acid glycoprotein. So read the list. Read the list twice or thrice. Now, coming on the most difficult and tricky concept, I must say, that is apparent volume of distribution. It is written like this, volume of distribution, VOD. VOD. I will tell you the formula also, VOD. It is written here. So, if I read this definition, it will be a bouncer for you. It will be a bouncer, a plain bouncer. Let me confess. When I was in second prof, I guess in 2005. Yes, in 2005, I was in second prof. So, I was in your shoes at that time. I don't understand this all thing, right? ये सब मुझे bouncer जाता था. What is apparent volume of distribution? ये पढ़ोगे ना कुछ समझ में नहीं आएगा. तुम्हें लगेगा कोई foreign language है. The language is not English. Some Greek, Latin languages there which I can't understand. What all this thing is written? What does it mean, ma'am? And how does being a doctor it is important for me? Being a doctor, shall I know all these stuff? Is it important to treat the patient? Yes, it is important. But मजे की बात ये है, the brighter side is that the things are very easy. You need someone to explain you, to crack the concept in front of you. Unfortunately, I didn't got someone to explain me the things so nicely, but fortunately you found me, right? So I must tell you in a very easy. So ये बाद में पढ़ते हैं. I will read this page later on. Let me explain you here. In this diagram, what is volume of distribution, right? Imagine a situation, you are having a patient, a subject, not patient, you are having a subject. The subject can be the animal or can be a human. You are having a subject in front of you, right? You want to calculate volume of distribution. Okay, I will come on that. You are giving a IV drug, IV से मेरा मतलब है you are giving 100% bioavailability. Now you can understand IV have 100% bioavailability. You are giving a IV drug, maybe the drug A. The name of the drug can be anything. A drug known as drug A. You are giving this IV. How much you are giving? You are giving 1000 milligram of the drug. So can I say if you are giving it IV, all the 1000 milligram enters in the blood without any wastage? Yes or no? Yes or no? I'm asking. You have to tell me the answer. Yes or no? Yes. So whenever you are giving the 1000 milligram of the drug IV you are giving. So all the drug enters in the blood directly. All the drug enters in the blood directly, and all the 1000 milligram is present in the blood. After some time, as soon as you are doing something, not after some time, immediately after that, you are taking a blood sample in a test tube. You are taking the blood sample in a test tube and you are checking the concentration of the drug in this blood, right? And you found out what is the concentration. Let me write. The concentration in the blood sample is 50 milligram per liter. Per liter. This is the concentration. I must say this is plasma concentration. The concentration of the drug in the plasma, in the blood. So that is 50 milligram per liter. What does it mean? 50 milligram per liter का क्या मतलब है? 50 milligram per liter का क्या मतलब है? You tell me. Means 50 milligram of drug is present in 1 liter. 1 liter of blood. 1 liter of plasma or 1 liter of blood. 50 milligram. So if, but you have injected 1000. No? How much you have injected? You have injected 1000. So 50 milligram requires 1 liter. Right? So 1000 milligram requires how many liter? I'm asking a question to you, a simple mathematics question. ये पढ़ा होगा ना mathematics में तुमने simple how to solve such cases. If 50 milligram of the drug requires 1 liter of blood. It is present in 1 liter of blood. How much blood, how many liters of the blood is required to accommodate, I must say accommodate 1000 milligram, because I have injected 1000 milligram. कितना आएगा आंसर? अरे कितना आएगा? You tell me ना. What will be the answer? If 50 milligram requires 1 liter, 1000 milligram requires, yes, 20 liters. How you have calculated? 1000 by 50, right? So 1000 by 50, that is you require 20 liter of blood. Oh my God, 20 liter? Is it 20 liter? You should ask me, ma'am, is it 20 liter? Humans don't have 20 liter of blood. All the humans have 5 liter of blood. Me, you, all normal healthy individuals, we all have 5 liter of blood unless until we are not dehydrated. Say yes or no. So you will say, ma'am, practically impossible. How you can say 20 liter of blood? None of the human in this world have 20 liter of blood. You are wrong, ma'am. Some mistake is there. So either you are not injecting 1000 milligram or the concentration is not 50. The concentration is not 50, right? You must say that. तो या तो तुमने 1000 इंजेक्ट नहीं किया तुम ऐसा कहोगे, और या तो कहोगे कि मैम ये आंसर गलत है, लेबोरेटरी में ये आंसर गलत है and this is not 50, this can be something else, because the answer cannot be 20. Practically सोचो ना, humans don't have 20 liters of blood. That's why I am saying this is apparent. The word apparent volume of distribution, this is not real. This is not real. This is apparent. This is apparent. This is pseudo. This is apparent. You got the meaning of the apparent? Apparent में weightage आया क्या थोड़ा weightage आया क्या apparent में? This is apparent volume of distribution. This is not real volume of distribution. This is apparent. This is a, now why this thing is happening? I'm saying no, both things are right. 1000 milligram I have injected, IV I have injected. So all 1000 I'm sure it is going in the blood. So you will say, ma'am, how it can be 50 milligram per liter? I'm saying it is also true. What you are considering right now, listen why this mess is happening. Right now you are considering whatever 1000 you are giving, you are considering all is present in the blood. But this is not the scenario. You are considering distribution is 0. But this is not the scenario. As soon as you are injecting the 1000 milligram, a proportion of it enters to the site of action and shows its mechanism of action. So in the blood, it will be less. You are not considering distribution. If you are not considering distribution, the answer is 20 liter. If you are considering distribution, right? अगर distribution नहीं होता, तो तुम्हारा answer आता 200 milligram per liter. You got my point? Okay, see this diagram. The diagram from a book, a good book, you can see this is the blood vessel of this person. I have drawn now. This is your patient and you can say this is the blood vessel. This blood vessel I have drawn, right? You can see in this diagram how much drug I am injecting. I am injecting IV. Can you see? I am injecting the drug IV. How much I am injecting? The same example, 1000 milligram. And after that I am collecting the blood in a test tube. And the plasma concentration found out to be 50 milligram per liter, right? If 50 milligram per liter, so if 50 milligram of the drug is accommodated in 1 liter, it is accommodated in 1 liter, 50 milligram per liter. So how much liter are required for 1000 milligram of the drug? I have injected 1000 milligram. For 1000 milligram, it will be 1000 by 50. 1000 by 50, so answer is 20 liters. So answer is 20 liters. That's why it is known as apparent volume of distribution, because technically speaking, 20 liter is not the answer. No human can have 20 liters of the blood, right? We are considering this situation. Listen, if I am considering none of the drug, whatever drug I am giving here, 1000 milligram, I am considering ki it is not entering in the tissue. But this is not the scenario. If none of the drug was entering in the tissue, the answer was 200 milligram per liter. Listen the same example again. I am giving IV 1000 milligram. IV how much milligram? I am giving IV 1000 milligram of the drug. So all the 1000 milligram is going in the blood, right? After that I am taking a test tube and taking the blood sample. If the blood sample have 200 milligram per liter, so what does it mean? 200 milligram. Chalo karo calculation. 200 milligram of the drug requires 1 liter of the blood. 1 liter of the blood, right? So 1000 milligram will require how much? 1000 will require 5 liter, right? But you will say, ma'am, answer is not 200. You are saying answer is 50 milligram. So where is the 150? The remaining 150. If I am saying this scenario, you will consider, ma'am, you are right. Humans have 5 liter of blood. ठीक है. The situation is a real situation, right? So if the blood concentration was 200 milligram, I was right. But if I am saying the blood concentration is 50 milligram, you will say, ma'am, you are bluffing. It cannot happen. You are wrong. You are bluffing, and some calculation mistake can be there. Some technical mistake can be there. This is not a real situation. I'm saying no, this is the real situation. So where is the 150 milligram? Instead of 200, why I'm getting 50 milligram per liter? Why? Because the remaining 150 entered in the tissue. The remaining 150 in the blood, only 50 milligram per liter is there. The remaining 150 entered in the tissue. So total 200 milligram per liter may say 150 entered in the tissue and only 50 is remaining in the blood. And I'm considering that 50. That's why my answer is 20 liter. So that is apparent volume of distribution. I guess I tried hard. No one will explain you with such a clarity. No one in this world I can challenge. इसको समझने में मुझे सालों लग गए कि apparent volume of distribution आखिर होता क्या है, मतलब क्या है इसका और टेक्निकली क्या मतलब है. अब दूसरा क्वेश्चन जो मेरे दिमाग में आता है, तुम्हारे भी दिमाग में ऑफ कोर्स आएगा कि मैम इसकी जरूरत क्या है, व्हाट इज द यूज मैम, व्हाई वी शुड स्टडी ऑल दीज, वी आर डॉक्टर्स, कम ऑन. सो बिफोर गिविंग एनी ड्रग टू द पेशेंट, शैल आई सी द वॉल्यूम ऑफ डिस्ट्रीब्यूशन ऑफ दैट ड्रग? Yes, volume of distribution is important clinically whenever you prescribe any drug to your patient. How? I will tell you in the clinical implications, right? So have you got it? What is volume of distribution? So see the definition now. You are calculating the volume of the plasma which is required to accommodate all the drug. You are injecting 1000 milligram now. To accommodate all the 1000 milligram of drug, how much liters of the plasma is required? How much liters of the plasma or the blood? One and the same thing. So how many liters of plasma or blood is required to accommodate the drug which you are giving IV? IV देना compulsory है, right? That then only you can assure कि all the drug is going directly in the blood. So the liters of the plasma is known as apparent volume of distribution, but you are considering the distribution to be zero. You are considering all the drug remain in the blood only, and you are considering human body as a homogeneous compartment having blood only, no tissue. There is no entry of the blood to the tissue. You are considering that, but this is not the real situation. Actually, out of 200, 150 is entering in the tissue, only 50 is remaining in the blood. That's why your answer is pseudo. Your answer is not right. It is a pseudo answer. Have you got it? Now read the definition. I guess you can get it. You can try. Still it's difficult, right? So read the definition. I will try. So after the drug reaches the blood, once the drug reaches the blood, it may be distributed to various tissue. It can enter to various tissue, right? And our body is a multi-compartment having multiple tissue. For example, in the blood, the concentration of the drug is 200 milligram per liter. Out of 200 milligram per liter, the 150 milligram per liter enters in various tissue. Some amount enters in kidney, some in liver, some in brain, some in muscle, some in bone, some in some in whatever. So because the body is a multi-compartment, multiple tissues are there. Now 150 is entered, so in the blood only 50 is remaining. This is the real situation. This is the real situation which actually happens in human body in patients, right? But what we are considering, the volume of the blood which is required to accommodate all the drug in the body. To accommodate all the drug in the body, if the concentration throughout is same, and we are presuming, this is not reality, we are presuming it. We are presuming the body as a single homogeneous compartment having only blood and no other tissue. Is it the case? No, we have multiple organs. So once the drug is in my blood, it enters in various organs. But if I consider none of the organ is present and I consider body as a homogeneous one compartment having only blood, in that scenario, the volume of the plasma which is required to accommodate the drug, that is apparent volume of distribution. And why it is apparent? Because we are presuming a situation. It is not real. We are doing a presumption. The presumption, right? The presumption is that we are considering the human body as a single homogeneous compartment having blood, no other tissue. I am considering the distribution as zero, but this is not reality, right? So you will say कि ठीक है मैम समझ में तो आ गया. Now in this scenario, how you have calculated, what is the formula? Let me come on the formula. What you are doing in this experiment? In this experiment, you are injecting 1000 milligram of the drug IV. So this is the drug injected IV. This is drug given IV. The concentration of the drug you are giving IV, that is 1000 milligram. And you are collecting the blood in a test tube, and the plasma concentration is 50 milligram per liter. This is your plasma concentration. So how the answer is 20? So it is 1000 by 50. 1000 by 50 is 20, right? So it is the drug given IV upon plasma concentration. So that is the formula. The one who wants to learn the formula, they can directly do the numericals by learning the formula, right? The one who want the concept, मैंने कभी ये formula याद नहीं किया, मुझे याद होता भी नहीं है, क्योंकि मुझे concept पता है. If you give me the numerical, I will consider the situation and I will do कि इतने liters के लिए, इतने milligram के लिए इतना liters, तो इतने milligram के लिए कितना liter, मैं वैसे निकाल लेती हूँ. But if you don't want to apply all these mathematics and concepts, learn the formula directly. तुम्हें concept तो समझ में आ ही गया ना? You understood the concept well. Now just learn the formula. What is the formula of volume of distribution? The volume of distribution which is not real, which is apparent, which is pseudo, right? It is dose given IV. The dose given IV upon plasma concentration. The dose given IV upon the plasma concentration. Everyone give me a thumbs up. Thumbs up means thumbs up, right? आया क्या मजा? समझ में आया क्या? So what is the formula? Who will tell me the formula? Who will tell me the formula? Just a second. I'm sorry. Volume of distribution is equal to dose of the drug given IV upon plasma concentration of the drug. Please learn this formula. The dose given IV in the numerator and plasma concentration in the denominator. So answer will be either in liters or in milliliters because it is the volume. So how many liters or milliliters of plasma or blood is required to accommodate that particular amount of drug? That is the formula. Please learn it. There are many numericals based on this, right? Numericals in your university exam, in your practicals of the pharmacology, and not only this, in your competitive exams also. So many numericals based on this concept. So that is the volume of distribution. I guess I tried hard to explain this concept to you. Everyone give me a thumbs up if you got it. So the formula is in front of you. Again, I'm repeating. The volume of distribution is equal to dose of the drug given IV. IV important hai, upon plasma concentration. The answer will be in liters or milliliters. Now, coming on the question, कि ma'am, why it is important for us to know the volume of distribution being a doctor while prescribing a drug to our patient? Why it is important? Okay. If you say, ma'am, कि the drug, there are two type of drugs. In the world, there are two type of drugs. There is drug A. Just suppose the first drug. I'm talking about the first drug, drug A. Drug A is such a drug which is going to the tissue in maximum concentration. 90% is going to the tissue and only 10% is remaining in the blood. Right? Such a drug. I will say this drug is sequestered in the tissue. Right? It is more sequestered in the tissue, right? And the second type of drug is drug B. Drug B. The drug B is such a drug which is going to a very less concentration in the tissue and maximum it is remaining in the plasma. 90% remaining in the blood only. Have you got it? This is 10-90, this is 90-10, right? So this drug is remaining mainly in plasma, not sequestered in the tissue. There are two type of drugs, right? Can you apply the formula 2 times? Can you apply the formula 2 times for me? What is the formula of volume of distribution? What is the formula of volume of distribution? Who will tell me? The volume of distribution is equal to the dose of the drug given IV. Dono, drug A and drug B, just suppose I have given 1000 milligram. Both of them I have given 1000 milligram. So this factor is constant for both. I have given 1000 milligram of both of them and I have given IV, both of them. Drug AB, drug B, dono IV diya. Lekin the denominator plasma concentration. The plasma concentration is different. For drug A, the plasma concentration is only 10%. And for drug B, the plasma concentration is 90%. So if you say volume, for drug A, volume of distribution for drug A, I am saying it is 10%. It is 10% in the plasma. And for drug B, it is 90% in the plasma. I have told you, na, the two type of drugs. Drug A is such a drug which is entering maximum in the tissue. So plasma mein se 10% hi bacha hai. Only 10% is remaining in the plasma. Drug B is such a drug which is not entering in the tissue, which is remaining in the blood only, right? So you tell me volume of distribution kiska zyada aayega? You can see plasma concentration is inversely proportional to the volume of distribution. So if plasma concentration is less, the volume of distribution is more. Yes? So it is 10%. So here volume of distribution will be more, and here it is 90%. So volume of distribution is less. So for drug A, volume of distribution is more. Can I say? And for drug B, the volume of distribution will be less. Say yes or no. Say yes or no. So I mean to say such a drug. Drug A kaun sa drug tha? Which drug was that? The drug which is entering more in the tissue have more volume of distribution. That is the meaning of volume of distribution. So by looking, just suppose here if you calculate, the answer will be 20 liter, 30 liter, which is not a reality. And here if you calculate, the answer will be 5 liter, 6 liter. So you will say, ma'am, it can be a reality, right? So here the volume of distribution is more. Here the volume of distribution is less. So looking at the volume of distribution, you can have an idea ki ye kaun sa wala drug hai. The drug which is entering in the tissue or the drug which remains in the blood only and not entering in the tissue. Preferably what is the nature of that drug. Now that you can decide. Just suppose there is a patient in my clinic. Imagine the patient is coming to me, ma'am, I'm having this complaint, I'm feeling this, I'm feeling that, a list of complaints. Based on that, I have done some certain investigations, I have seen the symptoms, signs, and I have made my diagnosis. Your diagnosis is this. You are having this disease. So patient ko matlab nahi hai diagnosis se. Patient will ask, ma'am, what is the treatment? Give me the treatment. And what is the prognosis? So I will give, okay, the treatment is this drug, you take this drug. But before prescribing any drug on a paper, on a prescription to any patient, you should have an idea about the volume of distribution. What is the volume of distribution of this drug? If this, just suppose the volume of distribution of this drug is 5 liter, it is quoted by the company, the brand, it is known. What is the volume of distribution of paracetamol, of all NSAIDs, of atropine, of everything? It is known. We know it, right? It is written everywhere. So the volume of distribution of this drug is 5 liters. So I will consider, okay, it is less. 5 liter is less. So it is such a drug which remains in the blood only, which is not going much in the tissue. And just suppose volume of distribution of a drug is 20 liter, 30 liter, 40 liter. So I will say volume of distribution is more. It is apparent, it is pseudo, it is more. So it is such a drug which maximum enter in the tissue. Right? So based on that, I can say कि उसका onset of action कितना होगा, उसका duration of action कितना होगा, मुझे dosing कितना करना है, ये सारी चीजें उस पर depend करेंगी. You got my point? So that is the volume of distribution. You got my point? The two type of the drugs in the world. I guess I'm crystal clear in my concepts. Say yes or no. तो पहला तो implication ये है. The first implication, I'm telling you the clinical implication. So there are two type of drugs. The drugs which are extensively bound to the plasma and they remain high concentration in the plasma. So they have low volume of distribution. And the drug which are sequestered in the tissue, which enter in the tissue, maximum concentration in the tissue, not in plasma. So they have high volume of distribution. So looking at the value of volume of distribution of a drug, you can decide whether the drug is entering in the tissue, yes or no. Volume of distribution is directly proportional to distribution. Distribution in the tissue. More is the answer, the drug is entering in the tissue. Less is the answer, the drug is not entering in the tissue, remain in the plasma only. And volume of distribution is inversely proportional to plasma concentration. You can learn these golden rules to crack out simple MCQs. Right? So that is the, ये दो हो गए, the two type of drugs. एक और तीसरा clinical implication है. One more, third clinical implication, how must I tell you? Imagine, you have to imagine a scenario to understand this. The third clinical implication, the last one. You are sleeping at your home. At 2 a.m. at night, you got a phone call from the nurse of your hospital where you work, right? The nurse is telling you, doctor, there is a poisoning case in the hospital, there is an emergency, please be there. And you are rushing to the hospital, the poisoning is an emergency case. Of course, the poisoning can be suicidal, can be homicidal. Imagine a young boy, a 18-year-old boy, tried to commit the suicide by ingesting certain drug, the overdose of the drug, right? And the patient is in front of you. The parents are carrying the patient is still alive, right? And of course, the parents want, doctor, save my child. My child tried to commit suicide by ingesting 100 tablets together. So the first question you will ask, name the tablet, which drug he has ingested, he or she has ingested. So they will show you preferably an empty strip. From the room, we found this empty strip and we guess this tablet or this drug, the boy has ingested together the 100, 200 tablets together to commit suicide, right? So this can be the scenario. The looking at the drug, the first thing you will think, key volume of distribution of the drug. Whatever drug the boy has ingested, what is the volume of distribution? As I've told you, there are two type of drug now. Now it can be drug A, the boy have ingested drug A, which is maximum present in the plasma, right? Maximum concentration 90% in the plasma and only 10% in the tissue. That can be drug A. And boy may have ingested drug B, which is less in plasma, only 10% in plasma, right? And 90% in the tissue, right? Now what is the treatment? What are the various treatment options of a poisoning case? What you will offer? One of the treatment is hemodialysis, hemodialysis. You know what is hemodialysis? In hemodialysis, we take, I'm sorry, just a second. We take the blood out. यहाँ पे मैंने लिखा नहीं है. You can imagine, we take the blood out and filter it in a machine and just re-inject the same blood to the patient. So dialysis is a machine in which will just do the filter. हिंदी में कहें तो छन्नी का काम करती है. ब्लड को ले लो, उसको छान लो और वापस री-इंजेक्ट कर दो. So this is the process of dialysis, right? So कौन से वाले सिनेरियो में dialysis will be useful? कौन से वाले सिनेरियो में dialysis will be useful? For drug A or drug B? You are having two drugs in front of you. Imagine you can say there are two boys in front of you. The one boy who has ingested drug A. The drug A is 90% in the plasma and 10% in the tissue. Another boy have ingested drug B. Drug B is 10% in the plasma and 90% in the tissue. In dialysis, you will take the plasma out. You will not take the tissue out. You will take plasma out. So the drug which is more in the plasma, you can filter that. But the drug which is less in plasma, जो plasma में से 10% है, such a drug which is only 10% in the plasma, so no use of doing dialysis ना. You will unnecessarily take the blood out, you will waste the time, you will waste the energy, you will waste the money, you will waste everything ना. The most important, you are wasting time here. You can try out some other treatment. Dialysis is not useful in the drugs which is having high volume of distribution. High volume of distribution, right? Yes or no? High volume of distribution means such drug is maximum present in the tissue. Very less amount is present in plasma. So no use of doing dialysis as a treatment. Try some other options of the treatment. Try out the excretion via kidney. Try out the vomiting. Try out some other thing, right? Whatever the treatment. Try out the antidote if present. But there is no use of dialysis for such a drug which is already sequestered in the tissue. अगर drug already tissue के अंदर है तो तुम dialysis करके क्या उखाड़ लोगे? Dialysis करके तुम blood निकाल के छान के वापस डालोगे, लेकिन blood में drug होना तो चाहिए छानने के लिए. Only 5-10% present है तो उसके लिए तुम नहीं waste कर सकते. हाँ 90% present हो तो बात अलग है, right? So we do not do dialysis. We do not do dialysis in case of drugs which is having large volume of distribution. Right, so तुमने empty strip देखते से decide कर लिया कि this drop, oh your boy have ingested dhatura, atropine for committing suicide. Dhatura have high volume of distribution and I will not consider dialysis as a treatment, so your treatment like this. And I don't know exactly for dhatura what is the volume of distribution, but volume of distribution for this drug is less, so we can consider dialysis, and volume of distribution of this drug is more, so we cannot consider dialysis as the treatment. So you can take the call. Being a good doctor, ऐसा नहीं कि चलो करके देख लेते हैं, डायलिसिस से फायदा हुआ तो हुआ, नहीं तो कुछ और ट्राई करेंगे. You don't have time. Come on, it is an emergency. You cannot do hit and trial with the boy. You cannot do hit and trial with your patient, right? You should be short कि ये करना है या नहीं करना है. So you should be crystal clear in your concepts कि 1, 2, 3, 4, 5. These are the steps to save the patient in case of emergency. You got my point? So all the drugs which have more volume of distribution, you should know volume of distribution of all emergency suicidal drugs. ठीक है? Don't do hemodialysis. It is a wastage of time, right? So that is the clinical implication. So have you found it useful? Have you found it useful? Please write down in the comment box. Is it clinically useful to know the volume of distribution being a doctor? Have you understood the concept? It was difficult, I agree. लेकिन मेरे efforts भी कम नहीं थे. I tried my best to explain you. Give me a thumbs up. Come on. At least appreciate my efforts. So we will be doing few numericals based on this now. This is the first question in front of you. Can you try this question with me? We will try together. Okay. So can you say what is information given in the question? The concentration of the drug in the blood is 40 microgram per liter. That is what it is given. What is this 40? ये 40 क्या है? It is the plasma concentration of the drug, right? And dose of the drug is 200 milligram given IV. यहाँ पे IV लिखा नहीं है. I am telling you the dose of the drug given is 200 milligram IV. Can you calculate volume of distribution? What is volume of distribution? So can you apply the formula with me? The volume of distribution is equal to dose of the drug given IV upon plasma concentration. Can I say yes? This is the formula. Can I say it is taking some time to display, I guess. There is a little bit delay, I guess. So this is the formula. Now apply the values. Apply the values. What is the dose given IV? Can you tell me? What is the numerator? कितना dose है? 200 milligram. Now you know the calculations in physics. So it is 200 milligram, convert everything in gram. So 200 milligram is 10 to the power minus 3 grams. Can I say 200 milligram? I converted milligram into gram. Now you know the conversions. मैं physics और mathematics तो नहीं समझाऊंगी ना यहाँ पे. I will not teach you mathematics here. I want to teach you pharmacology, not max, right? Or denominator is plasma concentration. It is 40 microgram. So plasma concentration is 40. Microgram को भी gram में convert करो. 10 to the power minus 6. So everything is in grams. Everything is in grams, right? It is microgram per milliliter, right? So what will be the answer? What will be the answer? I guess if you do the calculations, answer is 5,000. If you do, it is 5, or iska calculation, it will be 1,000, right? So 5,000 milliliter. It is in ml, right? 5,000 milliliter, or you can say answer is 5 liter. So answer is 5 liter. If you do the mistake in conversions, so you can be come with answer 0.5, 0.05. तो ऐसा mistake मत करना. These are the silly mistakes, right? So answer is 5 liter. You got my point? So same description is given here also. You can see you have applied this formula. We have applied this formula. We have converted 200 milligram into grams. We have converted 400 micrograms into grams per ml. So since it is ml, the answer is in ml, and we can convert it into liters. So you got it. So many numericals can be framed like this. One more question we will do. if the apparent volume of distribution of a drug exceeds the total body fluid volume. What does it mean? Question is difficult. Question is from AIMS, right? Few years back we have AIMS, right? We have AIMS before INICT. ठीक है? तो AIMS में ये question था. It is a difficult level question. It is looking simple but it is most difficult level question. ठीक है? First attempt में करना थोड़ा मुश्किल है. ठीक है? Read the question, understand the meaning first. Consider a situation when the answer of volume of distribution, the apparent volume of distribution, it is more than the real total body volume. The real total body volume is always 5 liters. We all have total body fluid, me, you, everyone have 5 liter. But if you are calculating the apparent volume of distribution, maybe 20 liter, maybe 30 liter, 40 liter, which is exceeding than this. When this will happen? When this will happen? Now I guess you can consider the answer. When this will happen? This situation kab hogi? The real is always 5 liter, but your answer is more than 5 liter. So you will say, ma'am, it is pseudo, it is apparent, it is not real. So when this will happen? In which scenario it will happen? Read the 4 options. You tell me what is the correct answer. When the drug is sequestered in the tissue, that is more drug is entering in the tissue, it is slowly eliminated from the body, poorly soluble in plasma or highly bound to the plasma protein. कौन से situation में होगा? Yes, you all are right. The correct answer here is A. So if the drug is sequestered in the tissue more, that is the distribution of the drug is more. So in the plasma it will be less. So the formula is volume of distribution. It is dose given IV upon plasma concentration. If most of the drug is already entering in the tissue, so in the plasma it will be less. So volume of distribution will be more because it is inversely proportional to the plasma concentration, right? So answer is A. So what I am saying, if the drug is maximum sequestered in the tissue, it is going in the tissue and sequestered in the tissue. Example, 90% is sequestered in the tissue and only 10% is here. So what is the volume of distribution? Volume of distribution is dose given IV upon plasma concentration. Plasma concentration is only 10%. So it is less. So it is inversely proportional. So volume of distribution will be more and definitely the answer will be more than 5 liters. It can be 20, 30, 40, 50, 100 liters. It is a pseudo thing, right? So that is the thing, right? I guess you got it. Now, if you got everything, I want to ask you 2 questions. You have to write your answer in the comment box right now. I will not tell you answers now. I will reply in the evening. So you tell me, 2 questions, right? This is the first question in front of you. Can you tell me the formula of volume of distribution? The 4 formulas are given in front of you. Can you tell me what is the right formula for volume of distribution? Again, it is a question from NEET PG few years back. So it is dose administered IV upon plasma concentration of the drug, or it is maximum tolerated dose upon dose administered IV, or is it dose administered IV upon lipid solubility of the drug, or it is T half of the drug upon dose administered IV. Can you tell me? I guess the question is very easy. You have to write the answer ABCD में से क्या है. This is question number 1. Question number 1 का what is the answer? You tell me from A, B, C, D. What is the correct answer? Write down in the chat box right now. Right now. ठीक है? That is the first thing. Can you tell me the answer of this thing? What does a low volume of distribution mean? Low volume of distribution. The answer is low. Low may you can consider it is as low as 5 liter, which is looking real, right? So it is low. The answer is low. So what does it mean? The drug is having low bioavailability. The drug does not accumulate in the tissue. The drug is having low absorption, or drug is not metabolized in the body. What does it mean? I guess it is a difficult level question. Again, a question from few years back, NEET PG, right? So you can tell me the answer if you know. If you got the concept thoroughly now, then only you can tell me the answer. Otherwise, rectification to kar loge, but in the exam again you will get confused. So don't do the rectification, understand the depth of the question, right? So these are the 2 questions I would like to ask. So write down your answer ABCD of question number 2. So only 2 questions I want to ask. What is the answer of question number 1? What is the answer of question number 2? Please write down in the comment box. I will definitely reply you, right? Now, just a second. You can ask your doubts to me on this contact number. My contact number is 983303832948. Please note down, and you can connect me on either WhatsApp or Telegram. Whatever is your doubts related to studies, related to your preparation, right? You can ask me without any hesitation. I will be happy to answer you if I can help you in your studies, during your preparation, during your journey, right? So don't hesitate to connect me, and don't forget to tell me your college name, university, your probable exam dates, what exam you are targeting. I can make a strategy for you. I can help you in making the strategy and share some important questions or list. I'm working on it. So I will definitely share you what important list of questions you want. If you are preparing for university exam, I will share you the list of important questions for your per se university. If you are preparing for FMGE, I will share you the list of important questions for FMGE. If for next NICT, I will share you that list. So I'm having all the list prepared with me and I'm working on it, and in a day or 2 I will share you all the list, right? Okay, so don't hesitate to ask your doubts on this number. Now, before ending, as usual, a small motivation. A small motivation. You know, motivation is required, yes, to study, right? Now, during your entire journey of MBBS, internship and preparation, if you are taking a drop, right? So it is a 5 years or 5.5 years journey, right? During which you are doing your MBBS, you are doing your internship, and then you enters for your post-graduation, either MD or MS. Out of the 19 branches, out of million, or not million, thousands of institutes available, and 19 branches are the option. All the 19 branches are available in all the institutes, right? But you want to do your post-graduation from your dream branch. Your dream branch is one among the 19. It is not 19. ऐसा नहीं है कि ENT मिल गया तो ठीक है, नहीं तो सर्जरी से काम चला लेंगे, पैथो मिल गया तो ठीक है, नहीं तो रेडियोलॉजी से काम चला लेंगे. No, it is not that. You want to become what? That will decide your life ahead, right? What do you want to become? Do you want to become radiologist, a pathologist, a gynecologist, a pediatrician, a dermatologist? Life of everyone is very different. And what you like from inside? What is your passion? You want a surgical branch or a medical branch? The first question, you want MD or MS? What do you want? You want such an emergency branch or such a, a silent branch in which emergencies are not there? You want a clinical branch or not clinical branch? You want to interact with the patient or you do not want to interact with the patient? You just want to work in the lab or in your own chamber. What do you want? So whatever you want, you can achieve that from one of the best institute where you can do your post-graduation. But during your entire journey, for the 5 years journey, there will be many times when you feel lonely. When you feel alone, you are alone. All your friends, colleagues, they are just watching movie, they are wandering here and there, they are eating, they are enjoying. And your non-medical friend, oh my God, they all got married, they all have children, they are settled, and you are alone in your journey. You are just studying, such a long duration, the 5 years. And if you are taking drop, it may be 6 years, right? It can be any duration of year. So many times will come, you will feel like just quit here, come on, just quit, we will see some other alternative. It is very difficult path and almost it is impossible. You will have this feeling, and it is natural to have such feeling, right? Being human, it is natural. Everyone is doing the bunk and they are just going to watch a movie, but you want to study from inside, but you are alone. None of your friend is with you, right? Everyone is dancing, enjoying, and you feel alone, right? You feel कि I'm not enjoying, so या तो सब गलत है या तो मैं गलत हूँ. अब सब गलत हैं तो उसकी chances कम है, ऐसा तुम्हें लगता है. लेकिन no, it is not the scenario, right? So remember, one day people will thank you that you didn't give. You didn't give now. You didn't give at such times when you are lonely. Whenever you are feeling like lonely, alone, and no one is, appreciating your efforts. You are giving much efforts, but no one is there to appreciate. So clap for yourself. Just clap for yourself and just, say thank you to yourself that you are doing good. You are doing good for the humanity, right? Of course, you are going to become equivalent to God after getting your prefix as doctor. You are going to have superpower, right? Doctor is not just a prefix. My name is Dr. Priyanka Sachdev. Doctor, ये doctor जो लग गया ना नाम के आगे, it is not just a prefix, it is a superpower. Whenever I give my introduction to anyone that I am a doctor, come on, my prefix is doctor. I am not only Miss or Mrs. I am a doctor along with that. So it adds value. It adds value to your name. It adds weightage to your name. It will give you an honor. So for getting that honor, one day people are going to thank you really that you didn't give up, doctor. You didn't give up at that time when you were lonely, when you were alone, and when you were working hard for us. So people will thank you. So work hard for that day. Whenever you feel like this feelings, the negative feelings now, you just consider that day, one day people are thanking me. I'm coming out of the OT and I'm saying your loved ones are safe. Don't worry. So their eyes will speak, doctor, thank you. Thank you. Whenever you say your loved ones are safe and trust me, I'm your doctor. So you see the eyes of the relatives, you see the eyes of the family, you see the eyes of the patient, they speak, the eyes speak and they will say you, doctor, thank you. Doctor, thank you that you are the God for us and thank you for that. So work for that day. Work. I can't express that feeling in words. Words नहीं है वो feeling तो feel की जा सकती है. So just close your eyes calmly and imagine that day. That imagination will give you the strength to stand alone. अकेले हैं तो क्या हुआ, लेकिन हम तो चलेंगे, right? तो अपना destiny खुद बनाना है. भेड़ चाल नहीं चलना है where everyone is going just move. No, no, no. You will make your destiny. Your result will speak. ठीक है? So with this, I would like to end this note. Right? If you like the lecture, don't forget to click on the like button. Share with all your friends, colleagues, everyone. Don't forget to subscribe our YouTube channel. You are not subscribing. And press the bell icon. Right? Press the bell icon if you want to get notified further. Thank you. Bye-bye. Study hard. All the best.